So we'll be discussing some few concepts today as related to obstetrics. We'll be starting what is known as a DIC. So having seen the DVT, which is what deep vein thrombosis, we have been looking at some blood disorders. We have looked at postpartum hemorrhage, that's a PPH and all. We'll be looking at what is known as a DIC. So DIC is fully known as what? Disseminated intravascular coagulation. All right. So it's just a serious, it's a complex condition. Now this is where your normal blood clotting process is not regulated. Haywire is haphazard, So it involves excess clotting. Do you understand? So when there is too much clotting, the platelets get used up, the blood clotting factors get used up. All right. Now next you start bleeding. You understand? Because the clotting factors have been used up, the platelets have been used up, so you start bleeding. So there's initial too much clotting, then later on too much bleeding. So what causes it? It's not the disease on its own. If you see somebody having disseminated intravascular coagulation, most of the times their skin will present like this. Like it shows that there's bleeding under the skin, So it shows that something is causing this bleeding. Of course, you can't just be bleeding like that, okay? So possible causes could be that the person has sepsis, that's like a bloodstream infection. You have like bacterial infection, it went to your bloodstream that is now spreading to the rest of the body. It could show that you have cancers of the blood, like leukemia. It could show that you have had severe trauma or burns. You could sometimes, you can see pregnant women with it, showing that there's complications, like maybe the placenta has broken up, or amniotic fluid has some one or two issues, right? Then sometimes it now shows that the person has liver disease. So because you have liver disease, there's some dysfunction in the formation of blood factors and all of that. It could show that you have pancreas inflammation, that's pancreatitis. All right, then sometimes some snake venoms, they can also cause this. All right, so snake venoms, they go into your body, they make your blood to now coagulate too much, it now tilt you into bleeding. All right, then sometimes it could be that such a patient has had blood transfusion not long ago, but the blood that they transfused to that patient was not compatible with the person's own blood, So what actually happens during DIC? Alright, so it's two dangerous stages. First one, clotting is too much. So small clots, they form throughout the bloodstream. Now they can block blood supply to very important organs in the body. Of course, those blood vessels are not too big. If you have blood clotting inside them, it can now narrow, the passageway for blood. Alright, so this can cause some organs. Okay, the shortage of blood supply. That's what ischemia. Then next, I told you that those platelets and clotting factors, they get used up, so the body runs out of them, so it will now tilt you into bleeding. Right. So if somebody has DIC, that's disseminated intravascular coagulation, all right, so what would you look out for you to know that, okay, yeah, this person actually has a DIC? So if the person is having unusual bleeding from the gums, okay, from the nose, from the wounds, right, the person is easily bruising or these red spots on the skin, all right, you know that there's a DIC. All right, then the person is urinating, there's blood in it. The person is defecating, there's blood in it. All right, the person is confused, or he has some one or two difficulties breathing. All right, then some organ failures in severe cases. So diagnosis is just all those blood tests. So blood tests will help you know if blood clotting factors are still sufficient, or if platelets are still sufficient. The medical history, you are just trying to look out if there's something that happened. The physical examination, this is where you go, you touch, you feel, you move, to see things for yourself. So treatment is, this person is lacking platelets, so you try to you can how will I put it, platelets concentrates. Okay, so you basically separate platelets to transfer it. Then anticoagulants, right? If the person is still in that stage where there's too much coagulation going on, you can give some drugs that can help to prevent coagulation. All right, then supportive care, if there's any organ affected, all right, you might have symptoms specialized to that organ, So you basically what handle it and all of that. It's respiratory, you give oxygen. Do you understand that kind of thing? So that's just what this disseminated intravascular coagulation simply entails.